if your reflux, your heart palpitations, your excessive sweating, your asthma symptoms weren't just random symptoms and they weren't separate? What would you think if I told you they were all coming from a similar place in the spine? Most people think of chiropractic as back pain, neck pain, headaches, but what we do specifically in the Gonset system is a lot more than posture. It's a lot more than tightness, stiffness, muscle tone, how I walk, one leg longer than another. It's super shallow. That's not exactly what we do. With the Gonset system, we're focusing on what bone moving it the right way, at the right time, the right depth, and measuring objectively and subjectively what is changing in the body and actually helping to resolve things repeatably and scientifically. Because specificity matters. BJ Palmer said chiropractic is specific or it is nothing. What we do is not just adjusting your mid-back or popping your upper back or CT junction, TL junction. If it's T5, it's your heart. If it's T6, it's your gut. If it's T3, it's your lungs. But why? Why does that work? And why can I repeatedly help people with these seemingly complex conditions that are medicated? How do we help those to resolve? And that's what I'm going to get into today. What's interesting is a lot of people mention headaches, migraines, low back pain, neck pain. What I've seen clinically is thoracic pain, mid-back pain ends up being one of the more debilitating and causing the most amount of organ symptoms. And I think it's been overlooked by virtually all practitioners. So in the 5-part series in the Gonset system, we do an interview, visualization, scoping. So we're checking nerve pressure, static palpation, motion palpation, x-ray analysis. And we combine all this together so that we have objective and subjective data so we can see what exactly is going on in the spine. How are we going to fix it? What exactly are we fixing in the spine? It's what we call a subluxation. Another word for it would be a sprain. Let's just say a sprain with nerve pressure. And what exactly is going on? You have disrupted disc mechanics. This triggers inflammation, and this causes nerve conduction to change. Just think nerve metabolism changes. So what I'm going to get into today with these specific bones, I see these ones almost daily, and they affect people in a wide range, and these are the typical expressions. When I hear T3, so this is right behind the thyroid, right behind the throat, straight behind me, and that has a large innervation with the thyroid, but the main thing that it talks to is your lungs. So how does it exactly talk to your lungs? It sends nerves to the pulmonary plexus. This is a nerve hub for your lungs and your bronchi. If this level gets distorted, sprained, subluxated, it's going to give you asthma-type symptoms, unless it's wet. If it's wet asthma, productive, and it's usually from the upper neck. It can also be related to recurrent bronchitis. If you feel like you're getting sick all the time, this can be related to that. Then how about the thermostat of your body? T4 to T6, we call this your calorific center. If I get a kid in here that has 102, 104 fever, and yes, I do see people with infectious diseases all the time. I think one of the best things you can do is get adjusted while you're sick. Helps your immune system. We know it helps T cells. Tons of research on that. But T4 to T6 controls your body temperature. So I can have kids come in here and they have a fever that's not breaking. I can adjust that area and it'll come down to 99 because it's not about stimulating or reducing someone's immune response. It's about balancing their immune response. Too much immunity, autoimmunity. Not enough immunity, getting sick all the time. Where is that balance? And making sure that this area is healthy is going to be one of the things that affects it. Next one, T5. T5 is related to your heart rhythm. It sends some sympathetic nerves that control your SA and your AV nodes. So this is going to impact heart rate, rhythm, and sympathetic tone. If you feel like when you're about to fall asleep, all of a sudden you start getting heart palpitation, or you feel like you have heart palpitations throughout the day, this could be the thing that's contributing. People are on proton pump inhibitors or antacids for a long time, 20 plus years, and that starts to destroy their gut. What if a disruption in one of the nerves that controls all the gastric cells in your gut is the reason why you're getting reflux? Yes, there's food and there's stress and there's all these other things as well, but why not eliminate the thing that could be the lowest hanging fruit? I see reflux, I see bloating, I see low transit time, all from this disruption in the mid-back. So the next time someone tells you your heart palpitations or your reflux or just stress or they're just genetic, why not have someone that knows how to examine your spine, check out your spine, and see if they can help you? I don't know about you, but guessing with my health isn't something that I like to do, and I wouldn't want to do that with you. Do you know anybody with these symptoms? Have you experienced any of these symptoms? Let me know in the comments below. I would love to link you up with someone who knows what they're doing.